The reason this is the best course I've ever taken is because of Dr. Todd Engel and also Dr. Christopher Phelps, but they made me feel very comfortable. They went over everything in a very matter-of-fact, basic way. It's easy to understand. However, they did talk about complicated topics, which are important. I was just very impressed with the structure and the format of the lectures, and as a beginning implant dentist, I feel that leaving this course, I feel very confident I can actually place implants in a very systematic and organized way. I think this course is going to change the way I practice in a big way. It's going to make me place more dental implants in my own dental office, because now I have patients that are begging me to place implants, and I'm able to do it in a very secure way. This is one of the most exciting and intense courses I have taken for dentistry in my entire life, and I've taken quite a bit. I've almost 1,000 credit hours of education. My patient this morning was very nervous. She was very inhibited by the procedure, but after being here for about 10 or 15 minutes, when she realized that Dr. Engel and I were going to take care of her, she was very calm. When she left, very happy, very satisfied with everything we've done, and I think she's going to be great. I think everything this morning went absolutely positive. The implant went perfect.
The only implant I placed was in school with an instructor right over my arm, and he did most of the work, and I got to watch basically. So this was a great experience. Now I sort of have it in my mind how I'm going to go back and how I want my paperwork to go, my consent forms, and everything else. Getting to place an implant is something that is a great confidence builder, because now you know what it feels like when you go back to do it in your own office. You have that feel, so that when you go in, you're not going to be scared if it drops a little bit, or if you can't get it in. You've learned how the bone is, how it changes, things to look into the bone, like the medullary spaces and whatnot, and you understand the bone a whole lot better. But this brings it all together, and so that you have the confidence before and during and after. They just want to sit here and help you to be the best you can be, and it's not just placing the implant and know where to place it. It's the aesthetics afterwards, and how to put the crown on and make sure and everything looks great afterwards too.
Well, this morning when I came into the implant class, and first when I sat down today, I was a little nervous. As soon as I sat down, I just took a deep breath. And then with the help and guidance of Dr. Engel, there were no complications. I mean, we were able to do a flap. It wasn't your most straightforward surgery. And once we were able to see the bone, everything just fell into place.
Today I did a sinus lift on a woman, and placed an 8mm implant on number 3. And so it's definitely got me ready and also excited about going back to Vermont and having the ability to actually place implants. Thinking about doing a sinus lift, and I talked with Dr. Phelps this morning, it made my stomach churn, but he was so cool, calm, and collected. We went baby steps through the whole procedure, and I can see myself doing this.
I think actually having a live patient, you never know what the situation's going to be when you have a live patient. They might ask a certain question, and you can come up with answers and figure out answers that maybe we didn't go over in the class, so that you kind of learn as you go on when you have patients here. And I think that it's really good to be able to see the setup, to see how everything is supposed to be sterile, and prepare the patient mentally and sterilizing us and them, and I think that was really awesome being able to do that.
I placed one implant in my residency with the Air Force, and had a little bit of education there and a little bit in dental school, but this was the first real hands-on, serious implant course. I actually had looked into a lot of the other courses available, and with this one, the big benefit that I saw was you get to do a live patient surgery, which I think is invaluable. And then, which I'm, just finished my first one, no problems, everything went wonderfully, and we were given the recipe to really just kind of make everything Very simple, straightforward, and made it very, very easy to understand, what we were doing and to get our feet wet. And I think the number one thing with this course is there's just no substitute for placing an implant on a live patient the day after you've gotten all of the information you need, to provide the service.